Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, how important is higher education? You want to stay with us for a segment on the reforms that might make higher education even better in the state of Pennsylvania, plus the ongoing debate about Medicaid expansion and the health insurance exchanges. What does all that mean, and how important is that to you? We'll be back with Pennsylvania Newsmakers following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we're going to talk about the importance of higher education and some significant recommendations to maybe change or modify the way in which higher education is delivered in this state. We have over 100 higher education institutions in this state. They're critically important. Our go-to guy on all things higher education is the Chancellor of the state system of higher education, Dr. John Cavanaugh. The go-to guy, you like that?
I like that. That's good to be here.
That's sort of a little different. All right, look, let's start out with a couple of basic facts here. You were a member of a large commission created by Governor Corbett, the purpose of which was to make recommendations about what? I mean, how would you describe what it was about?
I think the easiest way to describe it, Terry, is to think of it in terms of a strategic roadmap for the Commonwealth. It's been a long time since all of the different sectors of higher ed and the business community got together and said, where do we want to go with higher ed? So I think that a strategic roadmap is a good way to look at it.
And I'll tell you what, when you started your work, now think about this, you have labor and business, public and private sector, community colleges, and universities, and they agreed to something? Yeah. I mean, you know, that in itself, wasn't that quite remarkable?
Hey, look, we can use that as a model for other groups that need to learn how to get
like the fiscal cliff?
Well, yeah, could be.
All right, well, let's go. I mean, you made a whole series of recommendations, I think, not arguably, some of which are obviously more important than others, a whole list of them. If you were to say, pick from this list the 2 or 3 that you think are the most compelling and the most important to our viewers out there.
Sure. I think the most important is the rethinking of how we're going to fund and pay for and invest in higher education across the board, whether that's direct appropriations to institutions, whether that's to the state grant program. How are we going to help the citizens of the Commonwealth achieve that education? That's number one. Second, let's rethink the way we play with each other in the sense that institutions like to be their own thing. And we talk a lot in the report about the need for collaboration, to work together, to avoid duplication, to make those resources go further.
Now, let me interrupt you.
Sure.
I mean, that's a tough one. I mean, and you know, as someone who's been involved in higher education, I mean, every college sort of have its own mission, and we need a business program, or we need a new science program. How is that practical, do you think? I mean, that's a tough one, isn't it?
I think it's a lot less practical than it used to be. And you know, if we can just take a page from the state system, our default assumption now is that new academic programs need to be collaborative, either with multiple institutions or with multiple departments in the university, because we just can't afford all those standalone things
anymore. So you think money may be one of the driving forces?
Not only that, but you can leverage the resources in the sense that if you combine the resources from multiple institutions, no one institution has to pay for everything, and you end up actually with a better program in the long run than you might have otherwise if you had to do the whole thing yourself.
Yeah, does that mean, let's take community colleges that often do a lot of vocational technical training. Some folks there say, well, I want to go and get a 4-year degree, and there's always a big fight over how much credits you take, and you know, universities and colleges say, well, we're going to debate that. I mean, that's historically been a serious problem, not just within the system. Now, I know you've worked on that very hard to work on those agreements, but getting that all worked out would be one way to smooth the transition and not have students have to spend another year somewhere when they don't make
and we make some recommendations in the report about that, that we need to make those pathways easier to achieve. We need to make credit transfer easier to happen for the student, and to really look at it from the student's point of view.
Yeah.
You know, as a transfer student myself, I know what that's like when you're told you have to retake courses that you thought you already passed and all. But I really want to say that Rob Wunderling did a really masterful job.
He talked about getting. He was the head of the Philadelphia Chamber
of Commerce,
former state senator. Yeah, state senator, by the way.
But he was masterful at getting all these different entities and interests and all to converge on one set of recommendations that was unanimously endorsed.
All right, let's run to a break. When we come back, I want to ask the Chancellor specifically about this myriad of programs that we have and which ones the Commission has identified, some that can be more helpful. This is, after all, not also about good, in some cases, good solid liberal arts training. In some other cases, it's about technical and vocational experiences that more directly feed into the job needs of the state. Back with the Chancellor for that and more after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking with the Chancellor of the State System of Higher Education, Dr. John Cavanaugh. We're going into some of the recommendations of the Post-Secondary Education Commission. I know that sounds complicated. Put another way, it's how to make higher education in the state work better for you, for all of the citizens of the state. All right, let's talk a little bit about, the kinds of programs. Did you get into the kinds of programs that you think might help for future employment, technical, vocational? It's all I hear from people that when I go and talk to groups is, we have job needs. We can fill them. Send us people who have these experiences. Go ahead.
Yeah, I think what we heard in the public hearings, and we did a lot of homework on the issue too, is the match between the kind of education that people need after high school and the kinds of careers people want to have. Certainly, it's the case that there's plenty of room for everything. Certain jobs take maybe a year or two after high school. Others take a bachelor's degree. Others take post-bachelor's degrees. And one of the things that we try to make clear in the report is that we have to address all of those needs. If the Commonwealth's economy is going to continue to grow into the future, we can't just look at one slice of it. We have to look at all of it. We have to be investing in the basic research that's necessary to create new products and ideas and companies. We need to invest in the people who make those products. We need to invest in everybody in between.
And you also talked about, let's face it, like it or not, higher education's gotten expensive. I mean, the state system, I think tuitions are, even though they're among the highest in the country, comparatively speaking, are fairly reasonable. Yeah,
we're still a little bit under average in terms of average cost to go to college.
Right.
So we're very cognizant of that, and as we were talking about earlier, the more we can make it easy for people to return to school, to bring those credits back with them, and not lose time.
And that includes a lot of adults who want to come back for, a lot of
prior learning assessment, all those kinds of things are very important for people who've been out and have learned things that for which they should and rightly deserve credit.
And did you all talk about the fact that everybody who comes back doesn't necessarily need to get a degree, that you could come back in some retraining in a specialized area? I noticed...
Yeah, because especially if you want to change careers or change occupations, you may not need a full new degree. You may need new skills in this particular area. You've been out of school for a while, been out of the workforce for a while for whatever reason. You need to refresh. You don't necessarily have to come back and earn another degree. That's absolutely right.
I want to get to the tuition area, which is something that I think I hear a lot about, as you do, I'm sure, as the Chancellor. But the other thing is, I noticed that at Mansfield you were doing a program, particularly with new booming energy, Marcellus Shale. I noticed Philadelphia Community College is now starting a program. Is that, in a sense, what you're talking about? The colleges have to look at where these needs are and say, we got to help these industries because we can provide the workforce. It serves keeping people in the state, you know, and the brain drain. You know, we educate them, they go somewhere else.
That's exactly right. And you know, just to pick up on the Mansfield theme, we did both a 2-year degree and a 4-year degree, recognizing that the industry itself told us that they need people with different levels of skills and different kinds of education. So that's what we're responding to.
Let me go to this whole business of tuition costs and you know, affordability. Maybe private schools have a little different sense about that than public schools, and obviously private school tuitions are higher. Smaller, you know, the advantages and disadvantages to both of these systems. I'll try to keep my job while having this discussion. But I think so what is it that colleges ought to be just sort of generically looking at in order to keep tuitions affordable?
Well, I think we need to look at what does it cost us and what does it cost a student to get that degree? Where can we make that process more efficient, whether that's on the personnel side, whether that's on the transfer of credit and the issues that we've talked about. Can we leverage technology to make things less expensive? Not to say that everything is delivered online, but there are lots of uses of technology behind the scenes in the way that we do our business that can lower costs as well.
Yeah, finally, before I let you go, one of the things I noticed that I thought was particularly important is what you think we owe veterans who come back, and the sense that whether it's grants or scholarships or opportunities, because we know the plight of a lot of veterans. You know, many of whom have fought in 2 wars for us.
That's right.
They didn't create these wars.
That's right.
Caused the wars. They just went and fought them. What was the sense from the Commission about that obligation?
Well, as we mentioned in the recommendations, we really want to do as much as we can to reach out to veterans, reach out to active duty military, reach out to their families and dependents. And do whatever we can to make their transition back as smooth as possible. Whether that's individual counselors, whether that's different programs, whatever their needs are, we want to make sure we're doing the right thing by them.
Well, look, maybe you'll come back, we'll have you back, and we'll see how these reforms, how you're implementing them. All right, I guess there's no more important activity and concern at the moment than the expansion of Medicaid. We are about to go in 2014 to the biggest expansion of health care since perhaps the enactment of Medicare and Medicaid in the mid-1960s. There's a lot of uncertainty about that, a lot of big decisions that still have to be made by the state. We're going to call in one of our experts, as we often do, to get some advice and help in understanding all of that after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. There's probably no more important question confronting Pennsylvania government as well as states around the nation than the whole topic of Medicaid expansion. We're talking about 30 million Americans who will get health care in one form or another, 15 million under the Affordable Care Act, about 15 million, pushing 800,000 or so in our state. I have Marge Angello here. She's the executive director of the AmeriHealth Mercy Health Plan, and she's going to help us understand a little bit more. Let's talk about Medicaid expansion. In our state, the governor still has to make a decision about it. Why? And I know that you folks are for it. Why do you think the governor should say, let's do the Medicaid expansion?
Well, I personally think it's the right thing to do. Having been in the managed care industry in Medicaid over 14 years, we have seen some tremendous change within the population. We know Medicaid has changed. We have seen members who have lost their jobs come on board, people who need help, they don't have They're not the stereotyped medical assistance population. It could be my neighbor, your neighbor. So I think
talking about working folks,
right, who
may
have
be
lost,
laid off or have
yes,
some problem. Go ahead, finish.
So I do feel very strongly that, you know, we need to take a good look at it. And we know he has a lot, Governor Corbett has a lot to talk about it yet, but we support expansion of
now,
Medicaid.
So we're talking in our state about something, I mean, I've seen different numbers, and we've had some folks, like from the Hospital Association, I think, have estimated more than 1 million people could be involved. Is that what you hear? I mean, we're talking about very large numbers.
Very large numbers across the state.
Of our population.
Yes. Yes.
And it falls across a wide range of demographics and a wide range of in regions as well. I know you're involved in providing services in a whole bunch of areas in this state. But go ahead.
No, you finish.
So what we're basically talking about here is not just something that's confined to one region of the state, but it would be pretty much throughout the entire Commonwealth.
That's true. Very, very true.
Let's talk a little bit about. And here's where I get to the heart of the medical assistance in the state's Medicaid plan, and that has to do with, you know, what it is that you do that's important in connection with preventing folks from getting more serious problems. In other words, I call them wellness plans. You tell me what they are,
sure,
and why, and what you do and why they're important.
Sure. One of our biggest wellness programs is we call it Bright Starts, which is our maternity program, which we go out and we identify the members who are pregnant, make outreach calls to them, assure that they're getting their prenatal care very timely and as early as possible. As they go through their pregnancy, we continue to monitor them and follow them. If they switch over to become a high-risk member, they're assigned to another case manager who would follow her on a weekly basis.
Right.
That really helps when we have that mom go to deliver and the baby is full-term, healthy, full-term, and does not have to go to the NICU.
Now, if you take this argument that you're making and you spread it across a whole range of potential health care problems, high blood pressure, cholesterol, diabetes, we can go through asthma, we go through the whole list of them. What are you basically saying that by expanding these wellness programs to, in this case, let's just talk about the folks who wouldn't normally access the system, that we're doing two things: helping them individually with their health care problem, and in the long run, are we saving money?
Yes.
All right.
We decrease, if you take a NICU baby could cost anywhere from $50,000 to $1 million.
Right.
So if you prevent a NICU baby and you have a normal newborn, and just comparing that, the normal newborn's costs are much less than that. Could be $5,000 and that's it. So that's a big thing for medical assistance plans, neonatal children. The other programs that we do have, our goal is really to help our membership get care, be healthy, and be able to be out in the community. So by assuring that we outreach to those members and talk to them about our wellness programs and getting their tests that they need for diabetes, their hemoglobin A1Cs, their blood tests for heart.
We're going to run to a break. I want to get into a couple more examples because I think this is important. I'm talking with Marge Angello. We're getting into some of the details about why wellness and prevention in the long run is as important as almost anything else in healthcare, and reducing the cost and helping individuals stay healthy. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program with Marge Angello from AmeriHealth. We're talking about how important wellness and all these screening and tests that you get done in advance of getting something serious or preventing it. You know, one of the things we were talking about in the break here was how important education and outreach is to get people to understand how important this is. Maybe that's half, if not more than the battle. Go ahead.
It is half more than the battle, because many of the members, that once we get them and we do assessments on them, they don't really understand their illness, and they don't really know that it's important for them to take their diabetes medicine or whatever medicine they have to take. So we have specialized case managers that deal with the diabetes, the whatever, heart, member, and so on and so forth. So we educate them on the medication, make sure they have their medication. We check with their pharmacist to make sure they get it, because they won't fill prescriptions either. So that's part of our whole, if you're assigned to that member, then the case manager has to work the whole thing.
Now, one other dimension of this is getting, and I think one of the things we're getting better with medical records, you know, electronic medical records, is to try to get all these parts to function. You know, from the folks that what you do with physicians, with physician assistants, you can go through with hospitals. How is that working?
Well, we specifically don't have the medical record connections yet. However, we have the ability to, for the member, if a member likes to shop around facilities or ERs or whatever, we have that ability to get forms sent in to us that we review.
But all of that collectively is very important, right? All these pieces have to work together in order, A, to provide good medical coverage service, you know, getting people to the right folks who can help them, as well as making sure that we're not just doing needless tests and making the system inefficient, right? Terry. In the IDSs, which are huge integrated healthcare delivery systems, who have their own doctors, who have their own specialists connected, and we have many of those contracted with us, they have their own medical records. So if I'm a PCP and I see somebody tonight in the ER, and now somebody else sees them over here another night, that can connect. Here you won't, the physician that saw him the first night, the second night, he's not going to repeat those tests. Excellent, excellent. So, I want to thank you for coming in. This has been a great update. I've always argued for a long time wellness is very important, and you're a witness to that. All right, thank you for watching this edition of Pennsylvania Newsmakers, and as always, stay well.